Good morning, everybody. Thank you for joining today's webinar. My name is Lee Curtis, and I'm here with my colleague Beth O'Hara-McClavick, and we are with the Outreach and Education team here at Community Health Options. We're happy you've spent some time out of your day to join us. We'll spend the next hour or so going through details of plan and benefit changes to make sure that you have as much clarity and transparency as possible about changes in 2019, and we'll be sure to leave some time at the end for questions. In addition to this presentation, we will be recording this webinar and we will post it to our website, healthoptions.org. From there, you'll go to the individuals and families section and choose resources and then guides if you want to see a recording of today's webinar. Please feel free to use the chat function on the webinar to submit any questions. Most of these we will address at the end. One note about the chat function: if you do submit a question, please submit it to either everyone or to my colleague Beth O'Hara-McClavick, not to the host, please. We'll just pause here for one moment. So for today's agenda, the topics that we plan on covering is a review of PPO and HMO plans. As I mentioned, our benefit and plan changes for 2019, the re-enrollment plan renewal process, and our value equation as you make cost savings decisions and some of those cost saving opportunities. And then we'll cover some tools and resources available to you. So a little bit about Community Health Options. We're incorporated in 2011, and we started enrolling members in 2014. We are proud to be in our 6th open enrollment season. We provide affordable, high-quality health benefits through partnerships with members, businesses, and a broad regional network of providers. We have a member-focused approach. Our members serve on the board of directors. We have our upcoming election happening later this month. As I mentioned, we have a broad regional network of providers, and we'll talk more about that later. We are headquartered here in Lewiston, Maine, and our member services call center is also located here in Lewiston. We have an additional call center in Fort Kent, Maine, and for the busy open enrollment season, we have additional call center support in Ohio for that open enrollment season. As a reminder, we introduced HMO plan designs last year for the 2018 plan year. So this slide talks a little bit about the differences between PPO and HMO plan designs. PPO plans are defined as preferred provider organizations, and they require you to select an in-network primary care provider. PPO plans do not require a referral for specialist care, and they include out-of-network coverage. HMO plans, on the other hand, are defined as health maintenance organizations. They also require you to select an in-network primary care provider. HMO plans do require a referral for specialist care, and for us, this requirement will be implemented at a later date. And HMO plans do not include out-of-network coverage. You'll see a note down at the bottom about medically necessary emergency services. Those you can get from care from an in-network or out-of-network provider within the United States. Emergency care, however, that you get from an out-of-network provider will be covered as an in-network service, but you may have to pay the difference between the out-of-network provider's charge and the maximum allowed amount. This is known as balance billing. This would be in addition to any applicable cost-sharing responsibilities that you have, such as deductibles, co-insurance, and co-payments. And we will review those terms later on in the slideshow. So a quick overview of some of the benefit changes that we have upcoming for 2019. We aren't having as many changes this year upcoming for 2019 as we did last year, so many of our plans have remained the same. We have 15 unique plan designs with similar PPO and HMO product offerings that we had last year. We are introducing 2 new silver plans, HMO. Those are the Community Foundation and Community Vital plans. As I said, those are both HMO plans. And both of those plans are inclusive of the silver on-exchange variations, and we'll look at those later. We are discontinuing one plan, the Community Protect HMO for 2019. We have introduced a new telemedicine platform for behavioral health. We're calling this Health Options Online, and this is expected in Q1 of 2019. We'll talk more about that. CIF, or the Chronic Illness Support Program, continues to be available on select plans for 2019. We do have some cost sharing and limit adjustments for this year. All of this information will be displayed on plan documents. One cost share note to note is most plans have now moved to a copay for urgent care services. 2 HSA plans must still meet the deductible first, and then copays are applied for urgent care. But that is a switch. Most plans have now moved to a copay for urgent care services. Urgent care visits are still subject to the deductible with our catastrophic plan. And as I mentioned, no PCP referral requirement is in place for individual HMO plans at this time, but it will be implemented at a later date. And as a reminder, PCP selection is still required for all plans on both the PPO and HMO side. A little more detail on those new plans being offered. We have the names once again are Community Foundation HMO and Community Vital HMO. Those are on the silver metal level for 2019. And we have, as I mentioned earlier, only one plan being discontinued for next year. That is the Community Protect HMO. The members who were enrolled in Community Protect will be crosswalked into the comparable plan, which is the Community Best HMO. And this impacted fewer than 30 members, and those folks have been notified by mail. So some more detail on the limit changes for 2019. PT, ST, and OT, so physical therapy, speech therapy, and occupational therapy for rehab and habilitative services are limited to 60 visits per member per calendar year. Home health service visits have a 90 visit per member per continuous 12-month period limit, and that's for HMOs only. And for chiropractic services, there's a 40 visit limit per calendar year. Of note, the first 12 chiropractic visits are automatically approved. The second 12 visits are approved if progress is being made, and the remaining 25 through 40 visits require a prior approval. This next slide shows what re-enrollment and plan renewal look like. So basically those terms are the transition of current members from one plan year to the next. If a member does not actively re-enroll during open enrollment, which this year is November 1st through December 15th, they'll be crosswalked or renewed into a same or similar plan. This is known as passive re-enrollment. We do encourage you to actively re-enroll, however, to ensure that you have the plan that best fits your needs. If passive re-enrollment does occur for you, though, all 2018 plans will renew into the same plan with the following exceptions. As I mentioned, the Community Protect HMO plan is being discontinued. Members who passively re-enroll who were enrolled in that plan will be crosswalked to the replacement plan, Community Best HMO. And the other exception is the Community Safe Harbor plan, which is our catastrophic offering. Members who are in that plan and passively re-enroll will either be crosswalked to the same plan next year, unless you're aging off or otherwise no longer eligible for the Community Safe Harbor plan, or if members are turning 30 years or older prior to the 2019 plan year, those members will be crosswalked to the Community Reliant HSA plan, and that is unless you obtain a hardship waiver and actively re-enroll through the marketplace. We really want to highlight that open enrollment is a mere 6 weeks again this year, so please be sure to enroll by December 15th for coverage starting on January 1st, 2019. Also remember that you must make your first or binding payment before January 1st for coverage to go into effect. There is no grace period for the binding payment. So the renewal notices, this is the notification that folks get towards the end of the year around their plan renewals. The mailings have gone out to all members at the end of October. It includes information about open enrollment and those key dates that we talked about. Those notices include detailed information regarding the benefit and cost sharing changes to your plan, as well as an estimated monthly premium for 2019. For those members who are receiving an advanced premium tax credit, the APTC, the estimate in those notices will reflect the premium minus the tax credit that you received in 2018. It is important that you update your information on healthcare.gov to ensure that you are receiving the correct advanced premium tax credit due to you or cost sharing reductions that you're eligible for in 2019. So it's really important to update your information on healthcare.gov during that open enrollment period. So what can members do now? Enroll. We are in open enrollment. As I said, it ends on December 15th, so we have just begun. You can use our Find a Plan tool at healthoptions.org. You can get a realistic estimate of what your APTC will look like for 2019, as well as all of our 2019 plan choices. So here are our 2019 plans with another way to look at it. It's very hard to see. We recognize there's a lot of information, but it's a consolidated view of what our plans are, and what some of the more common services might be. So it shows your deductible across the board for all of our plans, and then, as I said, some of those more common services that you may avail yourselves to. We have a similar tool to this on our website, healthoptions.org, where you can compare plans across different services. This next slide outlines the out-of-pocket costs for the silver variants with cost share reductions. So this slide will only show you our silver plan, so that's why it's all one row across. These are all the in-network costs for the silver plans. With 6 silver plans on the marketplace, there are therefore 18 columns at the 73, 87, and 94 variants. One point to make, these variants, the 73, 87, and 94%, are designated by the marketplace based on income and family size and not by health options. So we then make comparable plans with reduced out-of-pocket costs to meet the cost share requirements of these variants. And we're going to talk more about the cost share reductions and advanced premium tax credits. And we know this is a difficult thing to see. We call it affectionately internally our eye test. But it does give a snapshot of what those cost share reductions will look like on the silver plans. So the Health Options Provider Network offers the same broad regional network for both the PPO and HMO plans in 2019, and we are contracted with every main hospital, as well as many New Hampshire hospitals and providers. Additionally, we have contracted with select centers of excellence in Boston and in Eastern Massachusetts. These folks are in network with Community Health Options. I won't read the whole list, but they primarily include the partners healthcare system, such as Boston Children's Hospital, Brigham and Women's Hospital, Newton Wellesley Hospital. We encourage you to use the Find a Provider tool on our website on the Doctors and Hospitals tab within the Individuals and Families section, where you can look at the in-network status for lab or other facilities, such as hospitals or urgent care centers, a behavioral health specialist or facility, or a primary care provider or specialist. Not all partners' health systems are in network, but we did include those that are. So we talked briefly about what you need to know in terms of some key healthcare terms, and we'll just review these here. Premiums are based on your age, so every year we get older, our premiums will go up. Tobacco use, the number of family members on a plan, and geography. So that's the 4 factors that premiums are based on. The Advanced Premium Tax Credit, APTC, is limited to folks between 100% and 400% of the federal poverty guidelines. An additional layer of savings are the cost share reductions. So this is when the price you pay out of pocket is reduced. These reductions are for folks whose income is between 100% and 250% of the federal poverty guidelines, and for those folks who select certain plans. So the APTC is, you're eligible for APTC credits if you're between 100 and 400% of the FPL, and you're eligible for an additional layer of savings, the cost share reductions, if your income is between 100% and 250% of those guidelines. We did include a small chart on the right-hand side to show you what those guidelines look like. The 2018 FPL guidelines do apply for 2019 plans. Some other key terms that we feel it's important that you know the definitions of. Deductible, that is a specified amount of money that you're going to pay before your insurance company will pay a claim. Out-of-pocket maximum, you might see this as OOP, is the most a member is going to pay in a plan year for covered services. So this is what we call the worst case scenario. Copayment is a dollar amount made by you in addition to the dollar amount that is made by the insurer for a service. Coinsurance is expressed as a percentage, and it's the share of a payment made by the member once the deductible has been met, in addition to a percentage made by the insurer. So first you meet your deductible, and then you go into your coinsurance phase. Formulary is the list of medicines that are covered by your plan, and network are the providers or healthcare facilities that are part of the health plan's network and which we've negotiated a discount. So this slide talks a little bit about the ways that we support our members to make healthy decisions. Our medical management department has a team that is comprised of nurses, social workers, and registered dietitians who help members maintain or regain optimum health and functional capacity. Additionally, they work with members to identify community resources that will best support their needs. Our care managers work collaboratively with the members' trusted healthcare professionals to avoid duplication of services as well and optimize that care coordination. When a member is identified for a service, a clinical specialist or a navigator will reach out to the member or a provider when appropriate telephonically. We also like to remind our members that if a member or your provider feels that you would need inclusion for any of these programs and would benefit from our medical management services, self-referral is encouraged by calling our member services number. And this will be at the back of the slide deck. That number is 855-624-6463, Monday through Friday, 8 a.m. to 6 p.m. So you'll see some of those pillars that encompass our medical management and health services. We're proud of our chronic disease management. The folks that are in the chronic disease management group support our members and providers by helping with individualized care plans. And those targeted conditions include asthma, COPD or chronic obstructive pulmonary disease, coronary artery disease, diabetes, heart failure, and hypertension. Our lifestyle coaches also help members to make the changes that they need to achieve greater health. We're also very proud of our behavioral health intervention. We support the integration of behavioral health and medical health by offering behavioral health visits at the same cost share as PCP visits, and also waiving the cost sharing for the first 3 behavioral health outpatient visits for those on non-HSA plans. Finally, we allow behavioral health visits on the same day as a PCP visit. And Healthy Options is our online resource, which is accessible from the member portal, and it provides a well-being assessment that we encourage you to take, as well as a library of thousands of articles on various medical conditions and procedures and tests. This is a snapshot of the dashboard that you'll see when you log on to your member portal. We do encourage you to set up your member portal if you haven't yet. Within your member portal, you can view medical and pharmacy benefits and claims. You can set up your automatic payment, and you can download documents as well as your member ID card. Additionally, you can select your primary care provider. You can enroll in mail order delivery and the RX Savings Solutions tool that we will talk about a little bit more. And in order to set up your member portal, you can go to our website, healthoptions.org, and then select Sign In. There you'll create an account using your member ID, your last name, and your date of birth, and then you'll go to this dashboard where you can execute many functions. In the future, you'll be able to sign in with just your email address and your password. So we highly encourage you to set up your member portal if you haven't already. We remain a member-directed nonprofit health plan, and we are committed to offering innovative programs to improve our members' health and to save money for you. Some of these approaches include the care management approach that we talked a little bit about, our chronic illness support program that we'll review in a moment. That coverage I mentioned of behavioral health and substance use disorders, that is in parity with medical services. And this partnership that we continue to have with RX Savings Solutions. So the CISP program, Chronic Illness Support Program, has been a unique and signature benefit offered within certain health options plans. The program is available on 3 bronze plans on and off the marketplace, and 2 silver plans that are available off the marketplace only this year. The CISP program addresses diabetes, asthma, COPD, emphysema, hypertension, and coronary artery disease. It helps members diagnosed with these conditions and living with these chronic conditions to receive reduced out-of-pocket medical and pharmacy services. For this year, pharmacy benefits on select Tier 1, 2, and 3 medications are going to result in reduced costs. Cost savings data has been compiled for the CISP program and is showing significant savings for our members with chronic conditions who are utilizing the CISP program. So the bottom line is that CISP is working. CISP is available on select individual plans. Those bronze plans include community-focused PPO, community-aligned PPO, and community-best PPO. Those 2 off-exchange silver plans that I mentioned that CISP is included on are community partner HMO and community capital HMO. The prescription drug benefit that is available through CISP when filled through home delivery includes 0 cost for specific Tier 1 generic medications that are used to treat the chronic illness. For select Tier 2 medications, the deductible is waived and the cost share is reduced according to your plan design. And likewise, for select Tier 3 medications, the deductible is waived and the cost share is reduced. Medical services is 0 cost when performed by an in-network provider for the following services. So you can see these under diabetes, asthma, hypertension, and coronary artery disease. I won't read them, but those services are reduced to $0 unless that is otherwise noted. Health Options is proud to invest in the treatment of chronic conditions by providing access to healthcare needs at a reduced cost. And as I mentioned, we have some data that's been compiled on the cost savings for folks in CISP. It is showing that those members who are enrolled in a CISP program have saved over 85% on routine healthcare. and 50% on medications used for the management of those conditions. So for example, these are just some of the data points that are showing for the savings that we're seeing for our members. For diabetic members, on average, members with diabetes have saved 87% on diabetic supplies when enrolled in a CISP program. Members diagnosed with asthma and who are enrolled in CISP have saved over 80% on the evaluation and management of that condition. For members diagnosed with hypertension, they have saved over 90% on routine lab exams compared to members with hypertension who were not enrolled in a CISP plan. Members diagnosed with coronary artery disease have saved over 95% on electrocardiograms compared to those members who are not enrolled in a CISP plan. And for pharmacy, members on CISP have saved an average of 50% on pharmacy costs. So we're really proud of these savings, and we look forward to passing those along to you if you enroll in a CISP program. For pharmacy and formulary, these are just some key terms that we want to make sure that you're familiar with. Our formulary is the Express Scripts National Preferred Formulary, and this includes all lines of business. Our exclusive specialty pharmacy is Accredo. Specialty medications, you'll see those denoted with SP on the formulary. These medications are allowed one courtesy fill at a participating pharmacy, and then you must fill through Accredo, our specialty pharmacy, exclusive specialty pharmacy. Mandatory specialty medications noted as MSP on the formulary. Accredo, again, is the exclusive pharmacy for MSP drugs, and drugs purchased at any other pharmacy will not be covered. So MSP must be filled through Accredo. One thing to note, HIV medications are moving to specialty pharmacy as of 1/1/19. CISP medications must be filled through the home delivery service to receive that reduced cost benefit. There have been some slight changes to the CISP list. Some drugs were added and a couple have been removed, so make sure to check the formulary. And just a reminder, home delivery, if you choose to enroll in home delivery, you'll enjoy a copay that you'll get 3 fills for the price of 2. So drug tiers with a copay, so those of you who have a medication that has a copay, you'll get 3 fills of that prescription for the price of 2. So not only is it convenient, but it saves money. I mentioned briefly our new telemedicine behavioral health platform. This is called Health Options Online. This is our way of increasing access to a larger group of behavioral health providers for mental health and substance use disorders by partnering with American Well. As I mentioned, we expect this new telemedicine platform to be available in Q1 of the new year. And it is confidential video and telephonic service for our members with providers to increase treatment access for a full range of mental health and substance use disorders. Some of the benefits of the telemedicine platform is it reduces the need for members to travel long distances to see a mental health or behavioral health practitioner. It's important to note the cost share is the same as an in-person office visit. And it provides members with another option to quickly see a psychiatrist for a follow-up visit after discharge from a hospital. Telemedicine does not include the use of audio-only telephone, facsimile, or texting or email. Within the member portal, our members can set up easy home delivery. Express Scripts will be your mechanism to set up that easy home delivery, and we've included a snapshot of how to do that. So members will log into the Health Options member portal that we discussed previously. You'll then click on Pharmacy Benefits, and then click this button, the orange button that says Register Now, and that's how you will be able to register. Once you've registered, you can click in the bottom section on ways to save money, look up prescription costs, and print forms. Express Scripts also has a mobile app, so we just wanted to mention that to you for the convenience of our members. Community Health Options continues to partner with RX Savings Solutions to provide our members with a no-cost benefit that helps them save money on prescription costs. RX Savings Solutions works with the member's physician and local pharmacy to ensure that the member receives the most affordable access to medications. Logging on to your member portal will allow you to see if any additional savings exist on current medications. It's a free confidential benefit. You as members will have tools to shop for different cost savings opportunities. And once you log in and register for this, you'll receive proactive savings from RX Savings Solutions via text or email. One quote that we wanted to include was one of our members indicated that she was told if she changed her medication from a tablet to a capsule, it would save $230 every 3 months, and it did. So as a reminder, to access the RX Savings Solutions tool, you simply need to go to your member portal at healthoptions.org to register. So now we have to figure out what these costs look like across plan choices. Where do we start? So this is maybe a little hard to see on the screen, but first, this is just a worksheet that we came up with as a way for you to figure out what might be an appropriate plan for you. So on the left-hand side, and we'll have copies of this available on our website, we ask that you, if you find this to be a useful tool, to figure out the amount or type of healthcare services that you expect to use in the 2019 plan year, and are they in network, which is important. One way to do this would be to use last year's explanation of benefits, EOBs. So on this worksheet, you can put the number of times that you used each service last year on the left-hand column. You also can add any health services that you expect to use, or if you expect any emergency room visits, hopefully not, you can include those as well. So medication costs and coverage are important, obviously, to your 2019 estimates. So we encourage you to look up all of your medications on the Health Options formulary and mark the tiers in which they are categorized. So remember, formularies can change, and they do change. So don't assume that the medications will be covered in the same way from year to year. So this is, we've included 3 columns for the different plans that you might be considering and some of the more common services that you might be getting. The next step is to figure out whether you'll get a tax credit or cost sharing, or if you won't. So if you use the Find a Plan feature on our website, you will not only be able to answer these questions, but you can see our plans and our premiums. Remember, qualifying for a tax credit, that advanced premium tax credit we talked about, means that you will purchase an on-exchange, not an off-exchange plan. Now that you know the services that you might need and the eligibility for tax credits and cost share reductions that you might be eligible for, you can start to compare that information across plans. One tool would be to use that 2019 plan comparison interactive tool that I mentioned that's available on our website now to compare plans. As you review plans, we ask you to think about what you will pay for out-of-pocket health services before you reach your deductible, and then you'll pay only a percentage, that coinsurance and copayments. Then, how much will you pay out of pocket for coinsurance and copays before you meet your out-of-pocket maximum for the year? The rest is up to you and your preference or needs.
And if I can just interject one thing, thanks, Lee. One of the things you want to consider when you're looking at plans is the network. So Lee talked about that earlier, but just to emphasize, your plans will have a different deductible, coinsurance, out-of-pocket maximum if you stay in network, or if you go out of the network which requires you to start a whole new bucket of deductibles and coinsurance. So one of the things that we really emphasize, we try to keep as broad a network as possible, and that's why every hospital in Maine, as Lee mentioned, is in network for us, because as you're looking at these things, you want to be checking that your providers are in network and making sure that you're looking at your costs in network for deductibles, copays, et cetera. And then if you're choosing to go out of network for some reason, what that will cost you. And that's just an additional layer of something to be thinking about.
Thank you, Beth. That's an important point. Thank you for adding that. Most importantly, if you get stuck or you need in-person assistance, there are assisters and navigators in your community, and we'll show you how to connect with them at the end of the presentation. Consumers for Affordable Health Care operate a helpline, and that number is listed here, 800-965-7476. They are an invaluable resource. They can answer your questions around health plans, and they can also direct you to an assister in your area. So as I said, if you need in-person assistance, an assister can help, and the good folks at Consumers for Affordable Health Care can help you find that in-person assistance. You can call that helpline listed. Again, that number is 800-965-7476. Additionally, healthcare.gov does attempt to list some of the local health resources available by zip code. We find that sometimes the information is not as updated as it could be on healthcare.gov, but we do list it because it can be valuable. That link is listed as well, healthcare.gov, and you would type in local help. You can also get a quote, review plans, and your coverage details at our website, so healthoptions.org, and then you'd go to the individuals and families section, compare and quote plans. And finally, we did list our Health Options formulary link. This is the list of covered medications. It is a very, very voluminous document, and so we encourage you to execute the search function, which would be typing Control F and then entering the name of the medication, so you don't have to scroll through hundreds of pages of text. So Control F is a nice little tip for you to use in order to be able to search a certain medication on our formulary. That formulary does change frequently, as I mentioned. Important numbers to remember. Our member services folks are available Monday through Friday, 8 a.m. to 6 p.m. That telephone number is toll-free, 855-624-6463. There is automated information available by calling that number 24/7. Our care management team, as I mentioned, are available to assist members with different disease management programs and the CISP program. The care management team also is accessed by calling the member services line at 855-624-6463. Care managers are available Monday through Friday, 8 a.m. to 5 p.m. Our behavioral health team, we're proud to partner with Maine Medical Center's Behavioral Health Care Program, and they are available to assist members with behavioral health requests. Our behavioral health team is available Monday through Friday, 8 to 6, and their telephone number is 855-481-7047. This number is also available 24/7 as a crisis line for members. That's the behavioral health line, 855-481-7047. And finally, we included our mailing address. If you'd like to contact us by mail, the mailing address is listed as well. These slides and presentation will be posted to the website, so certainly you don't have to remember all of this information. They'll be posted to the website within a couple of weeks, but we did want to highlight what these important numbers were to have on hand. At this time, we invite you to submit any questions that you may have. We'll take a moment to compile those. As I said, please submit those via the chat function, and you can submit those to either everyone or to my colleague Beth O'Hara-McClavick. don't submit them to the host because they don't get there. We'll be able to read them if you submit to everybody or to Beth O'Hara McClavick.
So Lee, one thing a couple of people have asked about has been, will the slides be available for downloading? And as Lee mentioned, we are going to be posting the slides and the recording of this webinar to the website. It doesn't happen with the immediacy that you may need in terms of as you're looking at your plans. You're now in an open enrollment. We want to make sure people get the information that they need. If you are someone who needs these slides more immediately, if you want to right now or before we close this webinar in a few minutes, if you want to put into the chat and send a message to me, Beth O'Hara McClavick, which you'll see on the participant list, and then put your email in and then just say I'm requesting the slides. We'll make sure that those slides get to you either through the same email that you provided on. It's best if you provide an email because some people are joining today just by phone. So we do not have an email for you. So if you're interested in the slides before they're posted to the website, before the recording becomes available in a couple of weeks, please right now put into the group chat to Beth O'Hara McClavick your email address and that you're requesting those slides. The 2019 plan design as a handout will also be available. So if that's something that you want, that chart, you can put that into your request. And that's great, and we'll make sure that we get those out to people. Again, that will also be on the website, but you will also have plan design materials on the website. You can find those under individuals and families. And there are resources there when you go to www.healthoptions.org. If you're having trouble finding something, we encourage you to reach to member services at 855-624-6463. And again, that's Monday to Friday, 8 a.m. to 6 p.m. And if there are any other questions, I'm going to keep an eye on that.
And while we're waiting for questions to come through, I also just want to mention that today's member roundtable is also being delivered in person next week. We will be in Presque Isle on Tuesday, November 13th. We'll be in Bangor on Wednesday, November 14th. We'll be in Augusta on Wednesday, November 14th, and in Portland on Thursday, November 15th. So if you have any friends or family that might like to attend an in-person session, please encourage them to choose one of those and register. That invitation would have come through email as you received.
And one of the other questions that we have that's come through, do any of the plans all offer alternative doctors? And the question specifically called out naturopath. What I would encourage you to do, because I think definitions are very different in terms of what is considered alternative, is to look at our Find a Provider tool. And that is on our website. If you go to healthoptions.org, there's an opportunity on the landing page to look at to go look through for who is in network with Health Options. If you have a question, maybe it's somebody who you're not quite sure is in network with us, again, you can call our member services number, the 855-624-6463. They can help you see if your provider or the person you're looking at, perhaps it's a specialist, is in network. They can give you a little help with how to use that tool and be able to offer you the ability to really find somebody who's in network who might meet your needs. So again, that can be accessed through the homepage of our website, our provider tool, or through your member portal. And we do encourage everyone to go on, as Lee mentioned, lots of functionality on your secure member portal. So hopefully that answers that question. And that's great. A number of people are requesting the slides to me or with their email, so we will certainly, I'm looking through to see if we have any other questions besides send me the slides. Right now, that's all that I see. If anybody, Lee and I will give it another couple of minutes. The webinar has a little time left on it in terms of we're happy to answer any of the questions that you might have that come up. But a lot of this information that they shared with you today is on our website, and please take some time and take a look. The other thing we let people know is if you are looking to shop around a little. Let's say you've determined that you have a newly diagnosed chronic illness that will be covered by that chronic illness support program, and you want to know which plans it's covered under. Those are all the kinds of things that you can call member services, or you can go on. All you need to do to check out your plan options is to put in your birth date, put in your zip code, the number of people, the birth dates of the other people in your family, and you can put in some estimated income, however you've been estimating your income, on the healthcare.gov site, and have the opportunity, without putting in a whole lot of personal information, to really look at the plans, make some comparisons, choose a number of plans to compare, and then be able to drill down. So I know all of us like to look at things in different levels of depth and detail, but you have the options to do that on the website. And again, with the help of member services if there are additional questions.
One thing I also did not mention is we have recently launched a new website, so we invite you to check that out. It's the same address, www.healthoptions.org. We hope that it increases the ability to find information that you're looking for. We think it's improved functionality and feel to it. So we invite you to check out our new website, healthoptions.org.
And I do have one more question, and this is regarding prescriptions. So the question is, can I use either RX Savings Solutions or go through the community health option? And we'll just clarify that. You have a formulary, and when we talk about Express Scripts, that's our pharmacy benefits partner, our pharmacy benefits manager, and they are the folks who are helping to expedite all the mail order, for example, and they are really the folks that help us expedite the pharmacy end of offering health insurance. The RX Savings Solutions, think of it as a program and an ability to potentially save money above and beyond. So they're not mutually exclusive. You're going to use Express Scripts and be part of the pharmacy program here if you have prescriptions, and those are covered on your plan at whatever level. Lee talked a little bit about the tiers. But you also have the ability to go on to your secure member portal, and or you can actually call member service. They can help you with some of this as well. But to sign up for RX Savings Solutions, and there may be opportunities to save money on the prescriptions you're currently taking. It's not an either-or situation. So we really encourage you, by signing up with RX Savings Solutions, it's only offering you additional potential for savings. And you can sign up and say, I want a text, I want an email. When I sign up for a prescription that has this prescription that might have a generic equivalent, and we are not in any way getting in the way of what's provided and prescribed to you by your provider, whether it be a physician, nurse practitioner, but we want to make sure that you know what your options are, and the pharmacist and your provider may work together and say, this is something that would work really well, that is a cost savings to you. So that's just, that's something else to consider. Another individual asked what plan we would recommend if someone is not going to qualify for a premium tax credit. So let's say for whatever reason, perhaps you're not going to be income eligible, it's modified adjusted gross income, that you're not going to be eligible for that premium tax credit. At that point, you can choose a plan on the marketplace, or you can choose any of our individual and family plans. So we do offer some plans that are not on the marketplace. Those become potentially something that you'd want to consider. Again, those are outlined pretty well in our rack cards and materials. You'll see in the materials and in the grid, and some of you have requested the grid, it'll say plans that are on exchange and off exchange. You want to get used to that language. So on exchange or on the marketplace means that they're available through healthcare.gov, and if I'm eligible for premium tax credits and possibly cost sharing reductions, those are plans I want to look hard at. But we also have plans that are available off exchange. They're available directly through us. You can access all of our plans through healthoptions.org when you go to our website. And one of the things that you can do is take a look at the full range of plans. If you're somebody who puts an income that makes it look like you're going to be eligible for those premium tax credits, we will recommend and refer on the website. There's functionality there to refer you to make sure that you're completing an application through healthcare.gov. And if you have questions on that, again, reach to our member services team. They can walk you through some of the plans that we have that are off exchange or off the marketplace that we offer directly to individuals and families.
And one thing I would just add to that too is that if you are considering a plan that is off exchange, two of the SISP program offerings are within off exchange plans. So if you or your family members are living with a chronic disease that we outlined previously, diabetes, asthma, that sort of thing, two of our chronic illness support programs are actually offered in off-exchange plans. Those would be the Community Partner HMO and Community Capital HMO.
That's great. And one of the other things that we didn't mention, there are a number of our plans, 4 of our plans have pediatric dental embedded in them. So you'll see that. And if you're somebody who doesn't have somebody eligible for pediatric dental, you want to make sure that you're not choosing a plan with pediatric dental. So again, you might just have a few questions. We might go back to that contact slide.
Oh, sure.
Actually, the one before that, Lee. And Consumers for Affordable Health Care, their helpline at 800-965-7476 can help you with some of those considerations, as well as the folks here at our phone number at 855-624-6463. And I think that may be all of the questions that we have, other than requests for slides. I'm just looking back through the chat function, and I think that is it. We'll give folks another minute if there's other questions that you have, or if you would like to receive the slides and or the chart with all of the plans on it. Please do reach to me at Beth O'Hara McClavick on that participant function.
Well, thank you so much for participating today. We appreciate the time that you took to learn about our plans and plan changes for 2019. We appreciate your questions, and those of you who have requested the slide deck be emailed to you, you can look for that soon. Thank you and have a great day.